still need that. You still need that HIPAA expert to review a lot of your policies and procedures also. So, all right, next slide. So we're going to look at, first, we're not going to look at all of these. We're going to look at some of the elements of the compliance, the ones that are, I don't know if they're actually bolded, but the ones that just today we're going to mention the policies and procedures, just touch on training and education and the importance of that and open lines of communication. We're not going to talk about the rest of them. The Office of Inspector General, however, has a really great website. There's some templates there and a lot of things for you to look at. I'm never in favor of just as easily do that. Thanks. I'm never in favor of reinventing the wheel if we don't have to. So we can get whatever you can from them, and I think it'll work out. Okay, next slide. So defining policies and procedures, you need both. The policy is the bigger picture, the broad description. It's goal-oriented. As this says, it sets the direction. It's the why. So it's the bigger picture, the why, it sets the value, and it's the overarching. We like to talk about policies that it sets the frame, but within the frame, you can have some flexibility. Then the procedures are the step-by-step guidelines. They need to be the more instructive so that staff can look at those procedures and implement how it's meant to be implemented. Another thing about policies, why they should be a little bit broader, because you don't want to change and revise policies all the time. Policies are usually need to be approved by the board. So you don't necessarily always want to change it. Every time you change it or revise a policy, you may need to go back in front of the board for them to view it and approve it. So broad enough that you can work within that. The procedures are the step-by-step. Those things can be revised, normally does not have to go in front of the board. It is just the step-by-step way that you implement the policy. For example, if you were going to have a policy around incident reporting, the bigger policy would be, why would you have incident reporting? The safety of the staff and the safety of the clients. Maybe the value behind the incident reporting, maybe funders who need it. So kind of the bigger picture of the incident reporting. The procedure around incident reporting would have to do with the step-by-step procedure. What is the timeline? Maybe even what is the definition of, and that could also be in the policy, what is the definition of an incident, of a critical incident? And the procedure would be who fills out the form, where is the form, where does the form go once it's filled out, when does the supervisor sign it, when should it all be done? Is there a 48-hour period of how it needs to be reported and when? So the difference in that. And don't be afraid if a procedure isn't working. When you are, especially new procedures, when you are trying to figure out if it's working, ask the staff. And I know for myself, in theory, when I'm writing something, it always sounds like it makes sense. But then in real life, when you're implementing it, you either left something out, or maybe it sounded right in my head, but when it's being done in real life, it didn't work out that way. So don't be afraid to revise it and to ask the staff if this isn't working. We don't want to continue doing it if it's not working. And it can be revised and tweaked, and the staff need to be trained on those changes and revisions, but normally does not have to go in front of the board. Okay, next slide. Continuing with the policy and procedures, you want to make sure there's good communication and meetings around the training of it. I was working with an agency, and interviewing staff about their policies and how the policies were implemented and what they thought about the policies. And very few staff even knew where the policy manual was. This was a while ago, so the policy manual was just being converted from hard copy to electronic. And so not only were the policies not communicated to staff on a regular basis, but staff didn't even know how to access them and were aware of them. That is not what you want the answer to be if you are if your staff is asked about your policy manual. You want them to know where to access it. Certainly they don't have to know everything about it. You don't have to memorize your policy manual, but staff should definitely know where it is, how to access it, and what they should look for. So if they're looking for a specific thing, they would know to look in the policy manual for that. So you want a training plan around your policies. You want staff to be trained annually on it. And in addition to being trained annually, you want them to be trained when there's changes, when there's revisions on policies and procedures. So you need a policy around that, but the important thing is that you follow it. We agencies get ourselves in trouble or in non-compliance when we have policies that we don't follow. So having a policy drafted that you need, and we're going to talk a little bit about Medicaid policies in a second, but having a good policy that you need is great. And then the next step is making sure the staff understand it and know about it, and then you making sure that you are following it. So every now and again, as executive team members, you need to make sure that staff are following the policies, that they understand them and that they're following them. So maybe attending some staff meetings every now and again, maybe twice a year, to review policies and make sure that staff don't have any questions, or making sure that it's all understood. The other thing that training does is it keeps it consistent and standardized. You want your policies and procedures to be implemented in as standardized a way as possible and consistently across the board, especially if you've got different sites or different programs. You want your policies being implemented as consistently and ensuring that consistency as possible. When you're making the changes is the hardest time to also make sure that staff are understanding the policy. So a little extra care if you are looking at your policies and thinking, oh, we do need a critical incident reporting policy, or we need a client rights policy, or we need some other things that you may not have. That's the critical time to make sure that staff understand and that training plan is implemented. And we're going to talk a little bit more about training when we talk about quality improvement and quality assurance. So a good policy and procedures addresses all of this. It addresses how it's going to be communicated to tenants and to staff, how staff will be trained, how it will be reviewed and revised. It's always a good idea to question staff about the procedures that are in place, especially important procedures like critical incidents or eviction, how something is implemented in terms of rent or behavior problems or lease violations. All of those things are really important to continue to revisit among the staff. And then as you change your policies or revise or add policies for Medicaid and for your fidelity reviews, one of the things that we did at VOA that was helpful to us is we did have a consultant do this, but is to have someone develop a spreadsheet. What policies do you have now? What policies are they good as they are? What of them needs to be revised to actually become compliant with the policies that are needed? And what policies don't you have at all that you need to write? And then you can add another column that would say, which of these policies do we feel a procedure would need to be added? And that'll keep everything organized in one place and easier for you to address. Okay, next slide. It's also helpful if policies have the same templates. It's easier for staff to read. It's certainly easier for anyone coming in to review your policy. So whether it's the state, whether it's the federal government, if you are CARF accredited or any other national accreditation, anyone that is coming in to look at your policies, it's so much easier if everything is in the same template, if the same way. This is just a suggestion. You can have the title, the effective date, the actual statement. You can have the purpose first and then the statement. And then you can have a link to the procedures, or you can have access to the procedures for that. You can use a different kind of template if that's more helpful to you, but having the same one and consistent one is really good. Just another word about consistency and ease. If you all are working with a national accreditation, or when the state comes in to do the fidelity review, I'll probably say this when I also do the fidelity review session, so I'll probably remind you of this. It's really important that the reviewer have ease of making sure where everything is. So if there's a specific policy they're looking for, or if you know they're going to be looking for these 5 things, then you want to have flags in your policy manual, or or print them out if they're in your electronic. You want it to be easy for your auditor to look at the specific policies that they want to review. So doing a little bit of that work ahead of time, what do they need, and finding it for them, so they just have to flip through, or having it printed out. Here's what you need to read, makes it easier for them. When things are easier for our auditors and reviewers, it all works out better. Okay, next slide. So let's get into some specific policies that you might want to look at in terms of Medicaid. These are more operational, big picture kind of policies that you want to think about, and look at your own policy manual and see what you have. Non-discrimination, your client rights and responsibilities, the staff rights and responsibilities, the staff grievance. There's also usually a section in your client rights that has a client grievance when they're appealing something or when there's an issue. If you use volunteers and interns, of course, your HR department should have all of their policies separated and clear. Privacy and HIPAA, we're going to talk a little bit about that, but again, certainly you need someone to look at that. Your organizational mission, vision, and value, productivity requirements in terms of billing. So those are some examples of bigger picture policies that are important. So in terms of productivity requirements, in the bigger picture, you want to address why productivity requirements are important, how it helps with the funding of the programs, how maybe it is divided depending on level of experience of staff or the degree of staff, their particular position. So those bigger picture things. The procedure would be more about what exactly is the productivity requirements for each staff person. So if you want to change that, it's just to that specific staff person, and you don't need to go back and change the whole policy. Okay, next slide. So these are some policies that you could have with accompanying procedures. These are, again, more operational. The next slide, we're going to talk a little bit more about the client procedures, but HIPAA. So HIPAA is one of those policies that needs the bigger picture. Why are we doing HIPAA? Of course, to be compliant, to maintain confidentiality of our clients, to ensure that no information is leaked, or that they have that our clients can be reasonably secure in that their information won't be shared. So that kind of bigger picture. And the procedure with HIPAA, as we're going to talk about later, has more to do with what the staff do. How does staff understand it? Where are your passwords kept? How often do passwords change? Those kind of things. The record request is also an example of a bigger policy that you could have, but procedures would be around what does someone do? What, again, like incident reporting, what's the timeline? How does a client request to look at their record? How are you going to do it? And is it done in combination with other people? Is there someone present? Those kinds of things would be written in the actual procedure. I always say when health emergencies are the same thing. When those kinds of things happen, you certainly don't want a staff person to be sitting there not having any ability to access a procedure or a policy and what to do. You want to make sure that staff know what to do. If there's a record request, if there's a health emergency or any kind of crisis, you want to make sure they understand what to do or who to call or how to access if they don't know exactly what to do. So those are really, really important things to have done ahead of time. Your quality improvement, we're going to go into that in a couple of sessions from now, the importance of that, and we're going to go into that in detail. Corrective action, staff supervision, many times agencies don't necessarily have a policy or procedure around the importance of supervision. CSH, it really gets behind the importance of staff supervision and the importance of making sure our staff are supported and having peers and supervisors around them to help with their staff development. It's really important. We don't want to throw case managers or direct service staff out with no support and feeling isolated and alone. We have very challenging jobs. It's very difficult. We want to make sure our staff are supported, and we should have a policy and a vision and value around that. Equity and inclusion, and then staff training, and of course the documentation of that training. Those are all really important policies to have with specific procedures. Again, one of the things that we did at Volunteers of America that was helpful was when we were getting CARF accredited. So we had, as you probably all do too, we had training that was CARF required. We had training that was the Department of Mental Health and Addiction required. We had training that was Medicaid specific requirements. And then we were also funded through the continuum of care. So we had some training for them. So our HR department was wonderful enough to do another spreadsheet for us that had all the staff's names and their hire date, and they had all of the requirements of all those different places, and they put them in this spreadsheet, and they alerted the program director when this staff person was due for what specific training. And that was really, really helpful because we had specific training for onboarding and then for 6 months or maybe first year. So that intra-agency collaboration was really, really helpful between the HR department and our family services department. Okay, next slide. These are some policies with accompanying procedures for clients, so client services. We need a consent for service, and I think with the benefit that you have, you want to make sure that this is signed by clients, that they understand what the service is and what they're getting. So you want to review all of that to make sure that there is a consent. For the procedure, you probably want an indication of what the timing is. Is it done on intake? Do you have a week? Who's responsible for getting it done? Is it property management? Is it services? And what are those intake criteria in terms of your clients? HIPAA, again, clients and organization both. Client documentation requirements, these are really important. What are your timelines? When a staff person sees a client, is it 24 hours? Is it 48 hours? Is it that day? What are your documentation requirements? Making sure that staff understand what those requirements are. And also making sure that you have in place how to monitor that. Most of us are going to electronic records. Is there a way to notify supervisors when documentation is done, and how is that monitored, and making sure that staff are following those timelines? Your Medicaid billing requirements, Program eligibility and enrollment, you want to make sure you follow that, whatever it is you say, whatever your intake criteria is, whatever your eligibility criteria is, you really want to make sure that you follow that. Urgent and on-call and safety, again, we don't want to have something happen in an emergency and staff not know what to do. That's not the time to start planning how to write a procedure or a policy, is when it happens. We want to make sure it's done before that. Critical incident, child abuse, and adult abuse mandating, the reporting and documentation, the client grievance and client rights and client satisfaction surveys. In terms of client satisfaction surveys, we're going to go over that in more detail with the quality improvement session, but you want to have something that states that you'll do them every year. And when will you do them every year? What will you do with the information that you get from the client surveys? And will you do any other specialized services for that specific year? Is there anything that you want to do? I know CARF was really big on us looking at something different every year for those of you who might be looking at CARF accreditation. So they wanted us to focus on one improvement or one characteristic each year for our programs. So that's also an option if you wanted to do that. This is by no means an inclusive list, and you know that you don't need to do anything else, but these are examples of things to put in place as you're looking through and walking through your policies and procedures. Next slide. And as I said, we're going to talk about quality reviews in I think it's the last session, but just to point out here, it's important to have a policy around your quality improvement. At Volunteers of America, we had an entire quality improvement plan, which again, we'll talk about in the last session, and making sure same process, making sure that staff were trained on it, they understood it. They were very involved because we did internal audits at Volunteers of America. And so program managers and directors were very involved in the quality reviews and how we did that. So these need to be really specific and followed up on with staff to make sure that what you thought were the procedures were good procedures, making sure they really are good procedures. What needs to be tweaked? What are you missing? Making sure that you have all of the staff feedback in terms of timelines and how it's done to ensure the consistency and standardization across your programs, and that it makes sense for the people doing them. Whenever things make sense to staff, whenever they have buy-in, whenever they understand the whole big purpose of it, when they know that their voice is being heard and their feedback is being taken, then everyone feels much more supported, and you will have a lot more compliance in terms of the policies and procedure implementation you're looking for. Okay, next slide. A word about equitable policies. One of the things that I want to stress here is the difference between equality and equity. Equity is about fairness and justice, and equality is about sameness and giving everyone the same thing. So, for example, equity would focus on giving people who need more support, giving people who need less support, less support. Equality would be giving everyone the same support no matter what they need, no matter how long they've been in the position, what experience they have, what degree they have, that everyone the same. The same would be for creating salaries. You would give everyone in the same position the same salary, regardless of their tenure or what they do, or again, their degree, their credentials. That what you want to do is you want to match that with their salary and match that with the supervision and support that they require or they need. That would be more equitable. But being equal would mean everyone gets the same no matter what. So you want to treat people and give them the support they need based on their skills, their strengths, their areas of improvement, their tenure in the position, how long they've been in direct service or supportive services in general. So you want to make sure that each person is getting what they need and support that they need, and not necessarily making sure everyone is equally doing it. Hopefully that makes sense. Okay, I'm going to stop there for one quick second just to make sure there's no questions or comments about any of the policies and procedures we were talking about.
We don't have anything in the chat, but
Okay.
folks are welcome to come off mute and chime in with any questions you have if you have them.
Great. All right.
Doesn't look
Okay.
like we have any.
All right, great. All right, next slide. All right, HIPAA. HIPAA is, everyone's favorite topic, but don't let it overwhelm you or stress you out. I think that if, as long as you do have someone reviewing your HIPAA policy who is expert in that, I'm just going to say that not every attorney or every lawyer is expert in HIPAA, so you need someone who really has that legal expertise in HIPAA who can review your policies for you. HIPAA really isn't meant to cause undue or unreasonable burdens, financial burdens, or staff burdens on agencies. It's really meant to just protect the wellness and the confidential information, PHI, of our clients. So PHI is individually identifiable information relating to past, present, or future physical or mental health or condition of an individual, provision of health care to an individual, or the past, present, or future payment for health care. So it's about what their mental health or physical health condition is. It's the provision of that service to an individual, and it's the transmission of payment for that individual. So it includes all of those things. Okay, next slide. So HIPAA, here's key terms, and it requires that you do many things reasonably. You'll see the word reasonably all through this slide. So again, it's not meant to be an overburden, but it is meant to be a protection for our clients. So we want to make sure that their confidentiality is set. We want to make sure their health information is protected. Having electronic health records creates another layer of security that we have to look at. You are a covered entity, so anyone who bills Medicaid becomes a covered entity, and a covered entity means that you need to follow HIPAA guidelines. And then the data is held data, that's your data that you hold in your record, and then the transmission data would be the data you transmit to the state, to the MCO for payment. So it's that, again, those two separate steps. These are important key terms to remember and to make sure that you cover when you're looking at your policies. So what it requires you as the staff person, that you do maintain, again, reasonable and appropriate safeguards. So you want to look at passwords, you want to look at where laptops are, how you protect your laptop, who's using the laptop. Do you have a special password for if you have an electronic health record? So what do you have in place technically and administratively to protect the PHI of the clients? You want to, again, reasonably look at any threats to your security. So I know here at CSH, our IT person occasionally will act as someone who's trying to hack into our system. So he does these just at random, and he'll test staff at random. and see if we pass. So we have our own internal risk analysis, I guess, for want of a better word, to make sure that we are responding to risks appropriately. So you may want to put some of that into place to make sure that you are protected against any threats or the integrity of the information. One other thing I want to say also before I forget is that with releases of information, so releases of information is what allows us to talk to other people on behalf of our clients. And back in the old days, for those who might remember, we had one, release of information for all these people. We just put, we were going to talk about anything that was helpful with the continuity of care. And that's not HIPAA compliant anymore. Your releases of information have to be one person, one entity per, that's the best practice, one entity per release of information. So you don't want to have 3 agencies on one release of information that a client signs. You want to have each organization or each entity has its own release of information. Releases of information need to be clear and concise in what it is that you are going to discuss and what you're not going to discuss. If there's anything that your client does not want you to discuss, that also needs to be on there. For example, if you're having a release of information signed with the landlord and your tenant, you certainly don't have to talk about their diagnosis or their physical health problems or anything, their medication they're on. Those things are probably not reasonable. So HIPAA says when you are discussing health information about a client, you should use the minimum amount necessary in order to provide continuity of care. So it certainly is allowed to discuss if there's a release of information for continuity of care. Continuity of care is important, but the minimum amount necessary. So if your client is having an issue with their lease, that's what you want to talk to the landlord about, not necessarily their diagnosis or their health issues. So that needs to be written into the release of information that you will share, only information related or behavior related to lease violations or neighbor complaints. And you won't be releasing diagnostic information or physical health information or anything like that. So that's an example of that. Also, our clients have the right not to sign a release of information if they don't want to. Our clients many times do have very valid trust issues with that kind of thing. So I would just have open, honest conversations with them. If they don't want to sign it, why? What has their experience been in the past? How can you reasonably help them to be comfortable, to feel comfortable that this is going to be for their benefit and not necessarily being talked about them, not for their benefit. So helping them feel comfortable and trusting that this is why you want to use it, for their benefit. And any questions or comments about any of that? Anyone have any issues with that kind of thing? I think the same thing goes for single site when property management is on site and you have those meetings together, that when property management is around and you're having the combined meetings, it's important that social services only talk about the behavior or the lease issues or anybody at risk of eviction. And then when you're talking more about the clinical issues or someone's individualized service plan, medication, those are separate discussions to have among the service providers. So it's important that that's kept to the services piece. Okay, any questions, let me know, Ava. Next slide. Okay, so clients, what do they have a right to? They can see their health record. So we already talked about the policy that you should have around record requests. You need a big picture policy, and then you need procedures. So if someone asks, again, you don't want staff fumbling around. You want them to know exactly what the procedure is and who to contact, what authority and approvals they need, and how that works. So you want all of that very, very clear, because they do have a right. When your staff are writing progress notes, you also want them to keep that in mind, that clients have a right to see it. And if anything would ever happen that you would go to court, it could also be read in court. So you want to make sure staff know that when they're writing their notes. So notes should be very professional, very factual, not necessarily anything that is subjective on the part of the staff person. So observable things, data, objective in terms of progress notes. They also have the right to ask who and how their information is being shared. That's why it's important to have those releases of information. They can have copies of the releases of information, because sometimes they'll forget who they signed it for, and they can revoke it at any time. I don't believe that you have to have an expiration date on releases of information anymore. I think you can say the end of a program, or you can put it for a year. It doesn't have to be. If you do put an expiration date, then you have to make sure that you get it signed again. That's the problem with an expiration date. If the client wants it expired in a year, you can do that, but you need to make sure that you get some notice to yourself, some ticklers that remind you of when releases of information need to be done again, if you're going to have an expiration date. But I believe you can put in there for the time that they live in your program, or from the, as long as they're in this program, this is eligible. You can check that, but I'm pretty sure that's the case. And that makes it a lot easier, so you don't have to keep going back and forth and getting a new one signed. Okay, next slide. So as I said, you are covered entities because you are billing Medicaid, which is the federal program. You are a covered entity, so you need to make sure that your client records follow what HIPAA requires. And again, you see that term reasonable. So you want to make sure that you are taking reasonable steps to keep your records secure and safe from hacking and from any security breaches. We're going to talk about offsite, I think, in the next slide. So when you take something out of your organization, what reasonable steps can you take at your organization? You want to, again, make sure it's password protected. How often do you change passwords? Is it every 3 months? Is it every 6 months? How long should your passwords be? When the automatic logout. So if you're looking at an electronic health record, you don't want it to be on your screen if you walk away from your desk. Noise machines, maybe if you're in an organization where the case management or counseling or nursing is right on site, and where is that office within the organization or within that building? You want to look at that. And if it isn't possible to have a separation, can you do noise machines? You want to think about the copy and the fax machine. If someone is, now people don't fax much anymore, but sometimes, but if you're copying or if you're printing something that is confidential, you want to make sure that you are right there by the copier when it comes in, so that it's not sitting on the copier. I'm seeing a black screen for some reason, a black part. I don't know if it's just me. There we go. So you want to make sure you're there right when it comes, so that it's not sitting in the copier for anybody to come in and grab and look at. Okay, next slide. So what about scattered sites? We do a lot of things with scattered sites. You need to have very clear policies and procedures around all of that. What what do people copy? If they carry anything, what do they carry? Is there you have a centralized location that you can have things when you're doing service plans or when you're reviewing service plans? Should you have clients in? Should you either pick them up or have them come into the office to do those kinds of things so that when you see them in their home, you don't have that information? Is it possible to give staff laptops? I know that's not always possible for funding, but if they are able to have laptops or tablets, what's the password? What's the protection? Making sure that there's no security breaches, that it's the IT and the security is as strict as it can be. But these are things that you want to make sure that your staff understands, that people are following. These are things that you probably want to ask staff about periodically to make sure that they are covering what your policy is and what your procedures are around that. These are things that might be needed to be tweaked, that you might have thought would have worked, but then isn't working. But this is an important part to make sure that you are asking staff about and that you're training staff to ensure that consistency and that standardization like we talked about earlier. Okay, next slide. So a single site, separate than a scattered site, there's other things to think about and other considerations when you're in a single site. That's about, we sometimes in the middle of a hallway, I'm not sure why we do it, but in the middle of a hallway, we'll start having a conversation about what so-and-so did last night, and they reported to the security desk, or so-and-so neighbor said that this person's music was on really loud, and and I understand that he, has a mental illness around this, but, those kinds of conversations should not happen in the hallway because you never know who is around. So those conversations always should happen in a room or an office that is closed where there's no one else around. Again, by the copier, you want to make sure if you're copying anything, if you're printing anything that is confidential, that you don't forget about it, but that you go right to the copier and get it off. Includes any discharge papers, any releases of information, progress notes, service plans, all of those kinds of things. And you want to make sure that you're not talking to a client either in the hallway. So even if the client doesn't seem to be bothered by it, it's not a conversation you should have if there's other people that can hear you. So talking to another staff person or talking to a client really should happen in an office, unless it's just about, someone walking their dog or some non-threatening kind of conversation, non-confidential. Okay, next slide. Make sure I got all that. So suggested to do, one of the things that I would say in terms of the risk analysis, I would definitely get a consultant. If you're going to spend any money, this is probably a good place to do it. It is such a niche and expert field, and not everyone is expert in it, and not everyone knows enough about it. So I would perform a risk analysis of your security, of your staff and how they understand it, your policies, all your passwords, so that you do have reasonable protection. And it is reviewed by someone who is an expert in the field and can tell you where your gaps are, where you're strong, where you're doing well, where you need to improve. So that would be something that I would invest in if possible. Once you're there, once you have something in place that you feel is reasonably good and strong, then you can designate a staff person who's going to be responsible for that. You could also have a client rights officer. And we're going to talk a little bit in the next couple of weeks about having a quality improvement person too. So these are things that you need to think about in the big picture for your funding and for your staffing. When you are looking at your staffing in terms of billing Medicaid and what do you need to do this, HIPAA, client rights, and quality improvement should be something that you think about. Excuse me. And then you can do your own analysis as well. Once you have a good program in place, a good HIPAA program in place and policies in place, you can do your own testing for that internally after you have everything in place. Okay. Next slide. So Medicaid does require that you have a policy on False Claims Act and the anti-kickback statute. So Medicaid wants to make sure that no one is benefiting from billing them. So their money is not going toward any fraudulent claims. When we're going to talk about internal monitoring in a little bit, but it's important that when we get referrals and that when we bill, that no one is benefiting from it. There are some businesses that allow the board of directors, say, to do some work or to have some referrals, or to, maybe they can stay at expensive hotels or go on trips. But when you're talking about Medicaid and Medicaid billing and Medicaid services, there can't be any remuneration of any kind in turn for Medicaid services or Medicaid billing. So you want to make sure that from the board of directors all the way down to direct service staff, that you have a policy on that and that you look out for it. So when we talk about monitoring, we'll talk a little bit about the billing piece of that and making sure that that you're billing for what you say you're billing for and that there's no mistake. So the part of it is willfully getting remuneration or kickback or falsely claiming. And then there's doing it by accident. So we all make mistakes. We all have accidents. That's why we want to make sure. That's why we do our own internal monitoring and we don't wait for the state or the federal government to come in and do it. We do our own because we want to catch our mistakes. But it doesn't matter if it's a mistake or if it's not a mistake. If you falsely bill, then you need to pay it back, or you as the entity need to fix it and reconcile it. And once that happens, then you're okay. If the state comes in and finds it, or the federal government comes in and finds it, it's a much bigger thing. So you want to make sure that you have your monitoring in place and that this doesn't happen. Okay, next slide. So just a question for you to think about, and welcome to put it in the chat. I'm going to just give you maybe a minute to think about this and think about what is it that your agency needs, or maybe where your agency is really strong and you could share with the team, with the rest of the group, how you are, how strong you are in specific things, and maybe help other people. So just give you about a minute to think about that. If you want to share any strengths you have as with your policies, or where you see gaps that you're going to need to work on. Couple more seconds. Another drink. Maybe everyone's doing well. Okay. I'm going to think that no one wants to share, so we'll keep going. If you want to share, just go ahead. So we talked about all policies and procedures in HIPAA. The other part of the communication, the compliance piece, is communication. And you want to have good communication plans and good communication training set in your agency. First, you want to think about the communication if there's an issue. So we've talked about a client rights officer, client grievance officer, and a staff rights officer and a staff grievance officer. So you want to make sure there is a mechanism that if there's an issue, your staff know how to report it, who to report it to, and what will happen. So what's the next step in terms of resolving an issue that they communicate about, and making sure that there is no retaliation. Especially with Medicaid, we especially want to make sure that if a staff person is reporting an issue about billing that they've noticed, we really want to make sure that that can be done freely without retaliation, and that it will be taken seriously and it will be investigated. So if there's a staff person who has maybe overheard another staff person talking about, well, I didn't see this client for 30 minutes, I only saw them for 5 minutes, or I talked on the phone, but I actually put the location as a home visit because I didn't feel like doing a home visit. Of course, none of us would ever do that, I hope, but just if that happens, that they would be able to report that issue quickly and get it resolved. So you want to make sure specifically with Medicaid that that's happening. Then we've talked a lot about sharing the policy manual, sharing the information, sharing procedures, making sure that staff understand the procedures, making sure that the communication and the training happens so that it's all consistent and standardized across the board, across your agency. So you want to make sure that communication back to you is important. So again, to the executive team or the managers and supervisors in the room, you want to make sure if a procedure is not working well, you want to know about it. You don't want it to keep going if it's not working. If there's a big gap if we're talking about incident reporting, and then at the end, we never say how it's going to get resolved or what happens to it after it's signed by the supervisor, that's a big gap that you want to make sure that you cover. So if staff have that feedback for you, it's important that you hear it and that you take it seriously and make the important revisions to that procedure. But really just about anything. If staff, especially direct service staff, they have really good insight and a good perspective that we should hear. So what mechanisms are in place that staff are able to share and communicate those things freely and formally as well. And then the board. So you want to make sure that you have board approval for the things you need board approval for in terms of the policies, but maybe also making sure that the board understands what is this new benefit, making sure that they know what's going on with it, making sure that they understand the compliance. If you're having a reviewer come in, making sure they understand what that means. Do they need to be a part of that review, or do they just want to be? And then one of the things that we did at a couple of the agencies I worked for, I think that was really helpful and enjoyable by the staff and the board, is maybe twice a year, we would have a staff person come in and describe themselves and their program, the program they work in, to the board. Maybe bring some success stories, some challenges, how long they've been in the program's goals and values. And it was a chance for staff to interact with the board, which they maybe never would have done in the past. And it gives the board a chance to meet a staff person that they never would have met before. So that was, I think, really good for everyone, but just that mechanism in place. And then we're going to talk about this in the QI also. You also want to schedule meetings, when those policies need to be approved by the board so that you don't miss it. Another thing you might want to think about in terms of communication is maybe doing a survey with the staff. We talk about surveying tenants, and doing client satisfaction surveys, but maybe every year you want to survey the staff to see what is important to them. Just like with tenant and client surveys, if you do staff surveys, you want to make sure that you close that loop. You want to make sure that you have some feedback loop as to what you're going to do with the information. Don't just give out a survey to give out a survey. No one likes to be asked for feedback if nothing's going to happen with it. So make sure that you have that feedback loop, what you're looking for, and maybe write a report or a summary to the staff on, these are the 5 priorities everyone was thinking was important. This is what staff felt was really positive about the agency. This is what staff felt like we could improve upon, but some feedback to that. Okay. Next slide. All right, so we're going to talk a little bit about internal monitoring, and then how long do we go, Ava? I can't remember.
We've got about a little more than 10 slides left.
We go to 2:30 or whatever.
Oh, what time we go to? Yeah, 11:30 PST.
Okay, great. So we should be able to get you out of here a little early. All right, so again, it's really important that we find our own mistakes. When we put an entire monitoring process and audit process in place internally at Volunteers of America, when we were going through our CARF accreditation and state certification, it was not popular. But as I said to them, and as I think is important, we need to find our own mistakes. We do not want the state, and we definitely don't want the federal government or any entity, even local county, coming in and finding our mistakes. We want to find our own, and we want to fix them. So it's really important to have an internal review process. The state is going to do their fidelity reviews as well. So they're going to be coming in, and you want to make sure that everything is in place. I'm going to talk specifically about chart reviews, but you can put this in place for anything. You can put this in place for policy review, you can put it in place for interviewing clients or interviewing staff or training, doing an audit on the training that staff, maybe you have a training plan, you can do an audit on what staff did what training and when. So you can put this monitoring in place to really review anything in terms of following guidelines, funding guidelines, and billing guidelines. So the first thing you want to do is put in place the timing and the frequency. So will you be doing it for a half a day every quarter? Will you be doing it for a day every quarter? Will you be doing it a half a day every other month? So that timing and frequency, and it depends. It depends on how many clients you have and how big your agency is and how many maybe new staff you have as opposed to tenured staff. So a lot of it will depend on all of that. How many programs this is impacting. Is it only one program that you're going to be billing? Then it'll be maybe not, you don't have to do that much. Maybe it is only a half a day every quarter. But if it's a lot of programs, then you might want a full day. So that's that timing and frequency piece. Then there's the number. So again, this is a chart review I'm talking about. So the number of charts for each, and then the type of review. So just a quick thing about that. If you have a program of 150 clients, you might want to do maybe 10% of those every quarter. If you only have 20 or 25, you may not want to do that much, and you certainly may not need to do it every quarter. So the number of records that you look at depends on the number of clients that you have and the number of clients in the program that you're monitoring. Then the type of review, as I just mentioned, you can do this with any type of review. With client charts, there's a couple of different reviews that you can look at. One is just compliance with forms. Is there a consent? You know, are there releases of information? Is there a consent for treatment in general? Are all of the appropriate intake papers there and signed? Is there a service plan? So just those forms, is the Medicaid card in there? Is, you know, so those, just the forms and that compliance is one type of review. That's what I call like the technical review, where pretty much anyone can do it. You can have an admin come in and just look for those specific things. Yep, this form is there. Yep, it's signed. It was done. The client was admitted on this date and it was done on this date. Yep, it was within that time frame of whatever our policy states that it needs to be done in. Are all the things checked off in that form? So that's one type of review that I would kind of call a technical review. Then the other one is more of a quality or peer review, where you're looking at what are the goals of the client. So are the goals of the service plan appropriate for this client's diagnosis? Is there an assessment? If there needs to be an assessment, is there an assessment in there? Is it appropriate? Is it signed by a qualified person? Does the service plan goals match the assessment? And do the progress notes follow in according to what the goals of the client are? So that's the more of a quality review in terms of the type of services and intervention you're providing, and should be done by someone that is a peer to that. So if it's a bachelor's level case manager, then a bachelor's level case manager can be reviewing that. If it's a master's level counselor, then a master's level counselor should be reviewing. Nurse should review nurse. So that would be that type of quality review that you're looking for. If there's, the other thing about this, if there is a certain number of sessions that you're supposed to have within a month, I can't remember if the FDS is a per unit billing or if it's a per member per month, but if it's a per unit billing, you want to make sure that if you billed for 45 minutes, then there's 45 minutes worth of notes there. If it's per member per month, you're supposed to see them 4 times a month, then you want to make sure that's in there. So that is more of the billing compliance piece. So there's the technical, there's the quality in terms of peer, and then there's the billing piece. When we worked at Volunteers of America, we did all of those, and we had a per unit billing, and we had 3 different services that we billed for. So every month, we did this every month because until we got better at it. We're not very good at it in the beginning. So we got a list of, we just did the high utilizers. We didn't do every single person that we billed for. We just did the 5 high utilizers. So the highest people that had the most billing for that month. And we went through the progress notes and made sure that there was a note with the right time on it that matched the billing. And of course, we found mistakes every month, but we reconciled it. We did have a consultant that helped us bill. We reconciled it and either gave back or very rarely did we not get paid enough, but we did find our own mistakes. So all of those reviews are important to have. And then I already talked about the staff, the correcting of the mistakes. So billing, for sure, you want to make sure that you're correcting those mistakes. You always want to close that loop of having the chart reviews or having the audits, finding the mistakes, correcting the mistakes. You want to make sure there's a loop and closing that loop and making sure that whoever is responsible, so if you have a quality improvement person or if it's the director, program director, whoever is responsible for this, that the communication is getting back to that person that, yep, this mistake was found, we fixed it, and now it's fixed. So you want to make sure that that gets back to, yep, it's fixed. In one of the agencies I worked for, who we built a lot of Medicaid, not Volunteers of America, but we actually had the loop being closing with the person who did the review. So we had the peer review, then whatever mistakes there were went back to the staff person record, who it was. They fixed the mistakes, and then it went back to the reviewer, and the reviewer reviewed the chart again. So there was 2 reviews, but we did make sure that the mistakes were in fact corrected. And then the reviewer did a summary to the program director on everything that was fixed and everything that wasn't fixed. You can't always fix everything, and everything that was not fixable went into that report. So that's another option that you can work on. Okay, next slide. So one of the things that's important, I think, to look at is, and again, it's important to have a policy around this as well, in terms of how you're going to do the chart review. Why are you doing? So your policy would be, again, that big picture of why you're doing reviews, why you're putting internal monitoring into place, the importance of making sure that you have a process where you find your own mistakes and fix them, and find trends and find issues. So that's the big picture policy on audits, internal audits and internal monitoring. And then the procedures and the plan would be how you're going to do it. So the previous slide that I had would be about the procedures. So if your program grows and you want to change the way in which the timing or the way in which you do monitoring, you can just change that procedure. You don't have to change the whole big policy. Your policy will still remain the same as to why you're doing this and the importance of it. You want to make sure that there is a plan in place for identifying your risks. So when you do your monitoring, it's important to have a report for the specific charts that are being reviewed, or training that's being reviewed, or paperwork that's being reviewed. But big picture, you want to have someone who, again, it could be your QI person, but you want to have someone who aggregates all that data together for maybe the year. Or if it's more urgent, you can do it in a 6-month period. So someone who's looking at the big picture, not necessarily just this chart or this training or this staff person or this client. So someone who looks at all of the data. So we did 3 or 4 audits this year. Here's all of the data around this audit. Where are our risks? Did we find that 50% of all the intakes weren't signed? Did we find that 50% of the client charts didn't have the importance of client choice in there, or the importance of client voice, or the service plans weren't completed to code or to compliance? So you want to look for those trends. Everyone's going to have some off at times, so you don't necessarily want to look at that, but you want to look at those risks. Were for whatever reason releases of information not signed or not complete, or did many of the clients not have a specific data release or insurance release or anything like that? So those are the trends that you want to have one person be looking at and providing to you as the executive team, or you as the supervisors. You want to make sure that you are having someone aggregate all that data and looking at it in terms of the risk and what might you need to concentrate on if you're going to have a review, or if to get ready for maybe an external audit or an external monitoring. So what are those? Where are you at risk? And you can also look at where were you great? What were your strengths? Were all the intake paperwork signed? Was all the service plans done on time? Those kinds of things are, I think, important for staff to know when you're monitoring. They don't always only want to know where they're lacking or what the problems are. So they want to also know where their strengths are and where they're doing well. Let me see, make sure. And then, of course, there's always the issue of, and you would want to put this in your policy as well, maybe it's not a trend, but maybe it's an issue with a specific staff person, or maybe it's an issue with a specific program. Maybe within this specific program, nobody did the releases of information correctly. So that's a training and education issue for the supervisor of that program and for the staff of that program. Different than trends. Trends would be where as an agency are we lacking and are we putting ourselves at risk for a violation or for someone to come in. That's one thing, but then there's another issue is if it is a specific staff person or a specific program or supervisor, that would need to be dealt with, maybe a corrective action, or could just be education and training. But you want to have a policy, a big picture policy around what should be done in that case as well. Okay. I think that's it. So I think I talked about this already in terms of how you do your corrective action planning. This should be part of your policy. So it's the big picture monitoring, audits, quality improvement policy around this. So you want to make sure that you have internally the closing of the loop. So you want to act in terms of corrective action. You want to make sure that whether it's a trend or whether it's specific to a program or a staff person, you want to act quickly and you want to resolve the issue. The whole reason that we're doing internal monitoring is to fix the problems. So you want to make sure that there's action that's prompt and thorough and accurate, and that the loop is closed. So you want to make sure that you have everything that you need for staff to be able to follow, and you want to make sure that staff are following it. And you want to track the resolution. So that's the whole piece of closing that loop. You can do like we did in terms of sending it back to the reviewer. You can have the reviewer do it, send to the staff, and then it go to the supervisor. But somehow that loop has to be closed, that these specific issues got resolved. And this is how we know they got resolved, because someone checked it and it was in fact fixed. So, and what wasn't, sometimes things are not able to be fixed. So if you look at a chart where a client has been terminated and you can't get their signature on something, that can't be fixed. So we want to know that too. So if you looked at 20 records this year or this past 6 months, this, 90% of them were fixed as reviewed by supervisor or by reviewer. 10% couldn't be fixed because client was terminated or something like that. So you want both what can be fixed and what can't be fixed. Were there any corrective actions? Was there any training or education that needed to be done? And did you do it? And then if you need to report it out, you don't always need to report out to external parties, but if you do, the data is there and you have it summarized in a report. For sure, staff need to know. One of the mistakes that we made at Volunteers of America was when we started to do these audits and we looked at a lot of things, we failed to get back to the staff on how they were doing, and that was a mistake. So we did the report, but we didn't actually meet with the staff afterwards. So we started meeting with the program staff quarterly to let them know how they did. And that was important. They got buy-in, they wanted to know where they were lacking, they wanted to know where they were strong. It helped them fix the mistakes quicker when they got that feedback and they were part of the process. Like I talked earlier, the more staff are part of the process, the better the buy-in and the better that they'll be compliant and help with the tasks and follow through on them. So that was helpful and good to know. And then we did one final annual report where we had all the staff. I think we had a big staff meeting and we went through everything that was able to be fixed and where we ended up as an agency in general, in terms of the score, so to speak. And then, you know, if there's any corrective action plans that actually need to be taken place with a program or with a supervisor, that's kind of both an HR issue and something that should be part of your policy in terms of making sure that you're following up with and taking care of any issues, that you enforce any issues or any actions that with consistency and standardization across the board with anything that has to do with monitoring of your charts, training, staffing, forms, any of that. Okay, next slide. That might be it.
Terry,
the last slide.
Go to the next slide.
I think, yeah. Oh, sorry, training and education. So that was the last slide. So I might have supervision too. So I think we've talked a lot about training and education and making sure that as the executive team, you have policies in place and that the staff get trained on it regularly. That the importance of the standardization and consistency across the board is important. But there's also training that needs to take place, as I mentioned with the Volunteers of America example. We had lots of different training depending on the funder. Some of it was mandated reporting, CPR first aid, case management type training. It was home visiting, safety. So it was a lot of different things. And that spreadsheet that HR kept for us was really, really helpful to make sure. So it's important that you have a training component to your policies, that part of it is onboarding. Part of it is maybe the first 6 months, and then the first year, and then annually. It's important that we not have training, not just to satisfy the funder, but what we know to be important for our staff quality of care and the best practice. And I always say one training does not an expert make. So you can't expect to have motivational interviewing training, for example, for your staff, and then they'll never need motivational interviewing training again for the rest of their lives. That's not reasonable. It needs to be practiced, and you need to have it at least every 2 years, specifically motivational interviewing. But for the supervisors in the room, it's important that you help staff get better and practice. If we don't practice our skills, we're going to get stale and they're not going to get better, just like practicing anything. If we don't practice, we don't get better. So it's really important to practice. So we want to test their understanding of the training at the time of the training, but we also want to make sure that we allow them time to practice, to role model, to talk to their peers, to provide that group supervision as well as individual. But for compliance reasons, you want to make sure that you maintain that documentation. At Volunteers of America, we had the staff keep their documentation. We had, if they wanted to, we had the supervisor keep it, and we also had HR keep it. So we were a little obsessed with making sure we have the documentation. Many times I know CARF allowed this. There will be people who allow, entities that allow supervision to show as documentation for specific training, or a staff meeting. If you have an hour-long training on something, you can do it at a staff meeting. Everyone signs it. You have a summary of what was said. That can also serve. So make sure you have that documentation. You know, if you have a pre and a post test, that's great. But sometimes even just the post test will help to measure someone's learning of that specific topic. If you can develop a pre and post test, that's even better. Okay, next slide. So here's some examples of things that you can consider. It looks like a lot, but a lot of it is maybe just reading also. Some of it could be in the policy manual. So your onboarding can be 30 days. Sometimes people's onboarding is 60 days. Whatever your orientation is for your agency, this is what you could have in that onboarding piece. So again, a lot of this should be in your policies and procedures. And it's important that they get this right away, because it is who you are as an agency. And you want them to get off on the right foot with all of this information. So this is important information for staff to have right away. You can see the non-discrimination and equity and inclusion, the client rights and staff rights, of course, all your HR policies, the organization, mission, vision, and values, all of HIPAA, mandated reporting, and of course, the duty to warn and the corrective action. So these are some examples of what you can put in place during that onboarding phase. And there needs to be some way of monitoring that this is done. So does HR own it? Does the program director own it? Who owns that this training will get done? Okay, next slide. And then the first 90 days, you could have this, again, these are just examples, making sure that staff get trained on the record requests and health emergencies. As I said, that you could also do this right away, because as I said, when it happens is not the time we want staff to learn what the protocol is. We want staff to know what the protocol is, or at least where to find it or who to ask about it. The quality improvement, your assessments and service planning. So what that paperwork piece, especially for case managers, that paperwork piece is really important to get right away. Your on-call system, the safety, you want to talk about client client de-escalation and safety, but you also want to talk about community safety if you're doing scattered site. Your client grievance and satisfaction, your staff supervision standards, you want to make sure that's put in place right away. New case managers, we don't want to throw them out. We don't want to throw them into the water to sink or swim. We want to make sure they're supported. So you want to have that staff supervision in place in the documentation piece. Next slide. And then first year and annual. So as I said, it's important that you have all of your training in pieces, but then you have annual training. So sometimes we forget again that staff need training every year. They don't just need it in their first year. They need every year. And survey them too. What do they feel they need that they're not getting? And some of it might be more documentation, some of it might be more best practice, some of it might be safety. So I think really gauging what they feel they need is important. And here's some options for you to consider. And these are the operational pieces. Next slide. And then the clinical pieces would be these. So housing first, harm reduction, assertive engagement, motivational interviewing, trauma-informed care, de-escalation, and cultural competency. And equity and inclusion is in that piece. Cultural competency is kind of the big picture for all equity and inclusion that needs to go into that. And doing these little by little would be important. And I think it's also as much as possible to bring someone in. Sending people out to do training is expensive and you only get one person trained. So bringing someone in to do staff training at once or team training is important. It builds team, it builds morale, it builds their confidence in each other and then in themselves. So I think doing it as a team is really important too. Okay, next slide. Supervision, you've heard me talk about this. CSH takes supervision very seriously. We have an entire series on it. That's how important we think it is. We never want case managers to be alone, to be out there with no support or making decisions on their own, making decisions without conferring with someone, not a place where we want our staff. So staff supervision is really important, both individual and group, making sure that we have dedicated time for you supervisors in the room, making sure you have dedicated time to invest, dedicated, regular, that you don't reschedule or cancel time with your staff. And as I said, it should be equitable. So maybe not every staff needs an hour a week of individual supervision, depending on how long they've been in the position, what their experience is before, their degree, their credentials, all of that. And some maybe when they first come, maybe they need a check-in maybe once a week, and maybe a little bit of a check-in in addition to that. So that investment of time in your staff is really important. I know that there have been supervisors who, when a report comes up, and we talk about this in our supervision series, that you're in a time crunch, a lot of times the supervision is the first thing that gets rescheduled because you figure it's just staff, I can do that. But I would say that I would recommend not doing that. It's really important for staff to know that they can count on that time. And then the group supervision is really important to be able to share ideas and get peers involved, build that team camaraderie, help team members help each other. And sometimes if we're really frustrated with a client and we can't figure anything out, someone with fresh eyes can do that. That's where the case conferencing comes in. So it's really important to set that up in advance and stick with it to allow staff that time and opportunity to talk about those challenging clients with each other. And if you are doing your internal monitoring or your policy review, you can also do it at those group meetings. So part of it can be operational and administrative, and then part of it can be clinical. But you'll have everybody in the same room at the same time, hearing the same thing. So if there's a procedure change or revision, everyone hears it at the same time. Everyone can ask a question and hear the answer at the same time, and you can clarify, and it helps with a lot of that standardization and consistency if you can do that in a group. Next slide. So just wrapping up, we talked a lot about policies and procedures and what you need to put in place and the difference between a policy and a procedure, and the ease with which you can sometimes revise a procedure. It doesn't have to go in front of the board, but a policy which needs to be kind of broad, sets the frame, and the procedures are the steps within that frame. The importance of communication of those procedures, making sure that staff understand what to do and how to do it, to ensure as much as possible the standardization and consistency across the board. Hearing staff if there's a procedure that's not working, or there's a gap, or there's a step that is constantly being overlooked, or we forgot it. It's important to get the staff feedback on that. Procedure, policy and procedure development in terms of getting it in front of the board. We talked about training and the importance of training, the importance of open communication, and of course the supervision piece. And then I added internal monitoring to this slide deck. At the end, we usually do it with documentation, but we also talked about the importance of that internal monitoring and making sure that you catch your own mistakes and fixing them yourselves, and having policies and procedures around that as well. Next slide. So documentation and billing is next. I usually do that, but I will be on vacation next week, so I will miss you. If there are any questions about the documentation piece in terms of how to write a service plan or a progress note, I'm happy to follow up on that through Ava if you have any, or Eva if you have any questions, or we can maybe address it in the quality assurance and improvement session as well. So any questions, any issues now?
Thank you so much, Terry. Yeah, just a quick reminder that next week we will be doing documentation and billing. We will be joined by our colleagues at Amerigroup to help facilitate that training. And then on Thursday, November 10th, there will be another Q&A session and technical assistance session. So I'm going to stop sharing my slides now so that folks can see each other, and feel free to just pop in if you have any questions. You can take yourself off mute or add them to the chat.
Great.
I see Michael says no question, just thank you for the comprehensive guidance.
Great, you are welcome. It may sound overwhelming and scary as I'm listening to myself, But I think if you take it bit by bit and look at it policy and procedure by policy and procedure, it'll feel less overwhelming.
Absolutely. And just a quick note to folks about the SharePoint or accessing the SharePoint folder. I know that I've received some emails from individuals who are having a difficult time accessing. It's a two-step process. So the first step is receiving an email from our IT director, who will invite you to create a password and log in, which will grant you access to our guest directory through the Microsoft platform. The second step is that you would then receive an email from me inviting you to access the SharePoint folders. And so if you're having difficulty logging in and creating a password, that is an access issue. But if you're not seeing the folders when you log in, that's because it's a separate link that you need to receive, and it's a separate email you'll receive to receive that link. With the exception of one person who I added today, every other person has been added to those folders and should have received an email. Please email me. Please do not email our IT director with questions about the link specifically. That is something that I can grant you access to. So if you're continuing to, if you look through all of your emails, if you look through your spam folders and you're not seeing anything from Eva Lerner inviting you to access the folder specifically, then please email me about that. The SharePoint folders contain everything that has been shared over email, as well as the recorded trainings. But if you've been attending all of the sessions and have received all of the emails before the sessions with the documents, then the folder doesn't contain anything else for you. So that's just a quick update on accessing materials. Any other questions for Terry or me? I see that Heather wrote in the chat, we're just beginning a permanent supportive housing program in 2023 after 6 years as a transitional housing provider. So we're beginning at square one to create a program that's eligible for FCS billing through Medicaid. The work plan template is really useful, very overwhelmed at this point, but the info is excellent. I'm very glad to hear that this has been helpful. And yes, it can seem overwhelming in the beginning, but that's why these tools are designed to be adaptable to your work, to your organizations. And we're always here if you have questions. Like I said, there'll be another technical assistance session on the 10th of November. If you have additional questions that you'd like to ask us, you can always email us.
Great. Sometimes there's local foundations that provide capacity building for housing providers and for organizations. And if you can take the opportunity to write a grant, a capacity building grant for a foundation, that might help you get a consultant to help with some of the policy writing. Policy writing is very tedious and can take a long time. So just a tip that that's a possibility. That helped us at Volunteers of America. We got a local foundation to give us $25,000 for capacity building. Yeah. Great.
Any other questions from folks? Otherwise, I'm happy to give you guys 45 or I guess 15 minutes
15.
back. 15 minutes back. All right, everyone. Well, thank you so much. Tune in next week for documentation and building. And again, reach out to me if you're having questions accessing the SharePoint. Thanks so much.
Great. Have a great rest of the day.